On a Sunday afternoon, Natalie Dunnege and her boyfriend, Russell Lifson, head to the park with Natalie's 13-year-old son, Straz.
Let's go.
You can't kick me from here.
He has autism, a developmental disorder that affects about 1 in 70 children in the U.S.
You have strengths on one side of your brain and weaknesses on your other side. Like, controlling your emotions or this and that, A strengths could be like coding or, focusing on one thing for hours.
Each week, an applied behavioral analysis, or ABA therapist, comes to the house.
Are you ready?
ABA therapy helps kids with autism learn life skills and how to control their temper.
Yeah.
Straz and his therapist, Gabby Raiders, create a schedule of carefully timed activities so he can get better at transitions.
This is the ID, right? The identification for the enemy. This is the width, height, speed X, and speed Y.
Ending a favorite activity can trigger a meltdown.
I can't do it. No, I can't.
Hey, sweetie.
If your kid doesn't get ABA therapy and they're having these really defiant and difficult behaviors, like these are the kids who end up in jail.
As a single mom working full-time, money is tight for Natalie. She can only afford a few hours of ABA therapy a week.
I want my son to be as successful as possible, so every time I get a raise, I just increase ABA hours.
She has insurance through Blue Shield, but getting mental health treatment has been really tough.
So I went on the site and you can see it says like doctors, facilities, dentists. Nothing about where to find a therapist. I called them and they emailed me a list of providers.
Oh, so this is the list.
Yeah, they all have a 3-month waiting list. And then after the 3-month waiting list, you have like 2 to 8 weeks of intake, and then hopefully you get approved.
So she pays $50 an hour out of her own pocket for her son's therapy. And now she faces similar hurdles finding a clinician for herself.
Blue Shield sent me a list, like, I should be fine, just make a few phone calls, I'll find somebody. I called everybody on this list. Only one place called me back.
I remember they would
I have to be as emotionally healthy as possible so that I can be there for Straz, because he has good weeks and he has bad weeks.
Turns out that Natalie's experience is by no means unique. I called 100 psychologists in San Francisco who take Natalie's insurance.
I'm wondering if you are indeed taking new patients with Blue Shield coverage.
Half said they're no longer taking insurance or new patients, and a quarter never even called back.
Thanks so much. Bye-bye.
Only 8 had appointments outside of normal work hours. I contacted Blue Shield for an interview, but they declined. Instead, they sent a statement saying that the provider has to notify Blue Shield if they're no longer taking new patients. They also said California is facing a shortage of mental health providers.
Insurance companies are saying that there's a shortage of mental health providers. It's hard for me to believe. I have many colleagues who are trying to get onto panels, and they run into the problem again and again where panels say, sorry, we're closed, we have enough providers in your area.
Dr. Hotman is a psychologist who accepts a variety of insurance plans. She can get up to 20 calls a week from people asking for her help.
It makes me really angry. It really is upsetting, and it makes me wonder, what are the insurance panels doing, and why are they limiting how many therapists they take onto their panels?
Why do you think they might be limiting the number of therapists?
If you make things too difficult to access, then patients will stop trying to seek the therapy and the treatment that they need. And I guess part of me thinks that that's probably a good thing for the insurance companies.
Another difficulty patients face is outdated or missing information about a therapist's specialty.
So for instance, if I need a cardiologist for a heart problem and I just get a list of all MDs that are on my health insurance panel, I'm not going to know who to call about my particular issue that I'm needing help with.
Many therapists complain that reimbursement rates are too low.
Over the past 18 years of being on their panels, they have not increased their reimbursement rates. And yet the copays and premiums are increasing for most of my patients.
Under state and federal laws, insurance plans must cover mental health services equally compared to other forms of care. But millions of patients across the country, like Natalie Dunnege and her son Straz, still struggle to get the help they need.
We're almost done with this. I like that.
Getting services through my plan, the hardest one by far is getting mental health services. There's nothing more difficult. I needed to find a doctor. I found one instantly. But mental health, behavioral health, psychiatrists, to have that be even harder, it's almost unbearable sometimes.
Good night.